Just as your birthday comes around once in a year, some of you, some of us, go for an annual physical every year. Do you go for your general medical checkup every year? Have you made it a routine to check out if you are in tip-top shape annually? Some of us only go to the doctor when they're sick or have a new problem or a new concern and are looking for a specific diagnosis or treatment. While a great number of us might even say, a medical checkup, an annual physical, do I really need one? Hi, I'm Dr. Hadiza Murlia Suleiman, your favorite holistic reconstructive surgeon, and welcome to the seventh live stream on the Medical Information Channel. And in this first episode of the Do You Really Need the Annual Physical Examination series, I will be answering that question. Do I really need the annual medical checkup? And guess what? I have an updated checklist of all the essential medical investigations you need to go for in order to have optimal health in the new year. For my ladies, just click on the link in my pinned comment in the comment section after, of course, watching this live session. And for my gentlemen viewers, watch out for your own checklist of all the essential medical investigations you need to do for your optimal health in the new year at my next live stream. Don't miss it. And don't forget to support the Medical Information Channel by buying us a coffee in my pinned comment still below in the comment section. First and foremost, who is your doctor? Do you have a family doctor? Or let me ask, who's your primary healthcare provider? Your primary healthcare provider could be your family practitioner. It could be your obstetrician, your gynecologist. It could be your pediatrician. It could be your internal medicine specialist. It's important for your primary healthcare provider to know your personal and family medical history. Did you know that? I will tell you the reasons why you should get a medical checkup shortly, but what are some of the examples of a general medical checkup? Well, they could be 1, periodical medical physicals, like what we're going to talk about today. They could be 2, prenatal childhood checkups. That's before, in early childhood or before giving birth. They could be 3, well woman or well man examinations. And how often should you even get a medical checkup? In the past, most medical groups advocated an annual health examination, that is a yearly medical examination. However, more recently, the American Medical Association and other similar groups have moved away from the yearly examination. They now suggest that medical checkups be termed periodic health assessments or examinations. And they have proposed that these periodic health assessments be performed every 5 years for adults over the ages of 18 years until the age of 40. That is, let me repeat again, the American Medical Association and other similar health groups have proposed that these periodical medical assessments or examinations can be performed every 5 years for adults over 18 until the age of 40, and then every 1 to 3 years thereafter. Well, the reason why they said this was because a lot of the testing that was done routinely in the past had not really been found to be cost effective. And in some cases, it caused, you may agree with me, an unnecessary additional testing and even anxiety in those who were tested and examined. However, my lovely viewers, these periodical health assessments or examinations or medical evaluations or whatever they are called, because there are so many names for them, need to be more frequent for those of us on prescription meds, those of us on prescription medication. And you'll also agree with me that there are many more of us on prescription meds now more than ever these days. Yes. Also, every day, as more and more disorders and diseases keep rearing their ugly heads, you will still agree with me that it is a great idea, isn't it, to get your general medical checkup at least yearly. And so, what are the advantages of the periodic health examination, the general medical checkup, the annual health examination? So many terminologies, right? Well, as primary prevention by giving immunizations against certain vaccine preventable diseases, such as the COVID-19, measles, and tetanus. To promote your healthy behavior, smoking cessation, to stop smoking, safe sex practices, pre-pregnancy advice, and advice on folic acid supplements. Also, to identify your risk factors for common chronic diseases by checking your blood pressure, your cholesterol levels, and performing pap tests for cervical cancer screening. These periodic health assessments are also great as a form of tertiary prevention. What is tertiary prevention, you may ask? Well, tertiary prevention is a process for optimizing your health once a disease has been diagnosed. An example is a management plan to prevent a person from having another heart attack once they already have been established to have heart disease. Why else should you get a medical checkup? To detect disease that has no apparent symptoms. And this is secondary prevention. And then also to update your clinical data since your last general medical checkup. What can you expect during a typical medical checkup when you go to your primary healthcare provider, which, as I mentioned, could be your physician, your pediatrician, your obstetrician, your gynecologist? What can you expect during this medical checkup? I know we all dislike the questioning, the prodding, the poking by the doctors, but please be patient because it's for my own good, your own good, for all our own good, isn't it? Yeah. Your doctor will ask about your clinical history, the health outcomes of your relations who have family history of diseases or certain disorders, your own past medical history, including a review of all the medications you take, and if you've had any previous surgeries, information about your workplace and leisure and the living conditions at home, your habits such as recreational drug use. Yes, please reveal that history to your physician. Please do it. It's for your own good. History of drug use, smoking, exercise, your sexual practices. In high-risk groups, sexually transmitted disease testing. Yes. Your seatbelt use. Do you use seatbelts when you drive? Do you protect yourself? Information about your bodily functions, your normal bodily functions, such as your eating habits, your sleeping habits, how often you urinate, how often you go to pee in the toilet, your bowel function, how often you go to do the number two in a day. Your vision. Do you see very well? Is it blurry? Do you use glasses? And of course, your hearing as well. How about the physical examination and the diagnostic tests your doctor will order? Are you curious to know about this? Are you curious? Well, these examinations and tests will vary depending on your gender, your age, and the information obtained from that clinical history we just mentioned. The clinical history the doctor just got from you. Your healthcare provider will collect the basic health information from you as well, like your weight, your height, your vital signs, that is your respiratory rate, your pulse rate, and other vital signs, including your blood pressure, your heart rate, your temperature. Now, all this will give, it will help you give your physician your trends, your bodily trends, your health trends over time. And it will also investigate, your vital signs that are outside of the normal range. He or she may assess your general health by checks of the following. I'll mention them. Your heartbeat and your breathing sounds by using his or her stethoscope. An examination of your head, your neck, including your tonsils, your lymph nodes, your thyroid gland, an abdominal examination to check for any tenderness, your liver size, a check of your muscle strength, your reflexes, your balance. Laboratory tests, such as your full blood count or your complete blood count, your blood chemistry, your urinalysis, and of course, a review of some recommended cancer screenings. And of course, a woman's yearly checkup may also include a clinical breast examination of both breasts and a pelvic examination. While, on the other hand, a man's yearly checkup might include a testicular or prostate examination. Your doctor will discuss basic recommended health screenings with you. If you're a woman, your provider will talk with you about regular mammograms and pap tests. And as I said before, if you are a male, those recommended health screenings may include your prostate screening, including the prostate-specific antigen blood test. Don't forget to get your own checklist of all the essential medical investigations you need to do for your optimal health in the new year. In the comment section, click on it after watching this live session. Ladies, you'll get yours today. Gentlemen, watch out for your own checklist on all the essential medical investigations you need for your optimal health in the new year at my next live stream. Don't miss it. Whatever your gender, your doctor might recommend other health screenings, like checking your blood cholesterol, your blood sugar levels. The checkup can also serve as an update time for your vaccination status. If you're at least 50 years of age, your provider will likely recommend that you schedule a screening colonoscopy to check for colorectal polyps or signs of colorectal cancer. We all know how common it is these days. Every day we hear in the news that, somebody famous or somebody not famous has been diagnosed with colorectal cancer. I mean, I think a few days ago, there's this very famous actress, Kirstie Alley. She used to act in this comedy in those days called Cheers. She was diagnosed with colorectal cancer a few, I think, years ago, and she passed on just recently, just a few days ago. I mean, colorectal carcinoma or cancer is quite common. So testing, screening for colorectal polyps or signs of colorectal carcinoma, this test is recommended every 10 years and more, and even more often, should I say, if you have a history of polyps or a family history of colorectal cancer. And because many people suffer in silence, because of those behavioral health conditions we have, especially still these days, like depression. Your yearly checkup might even include a behavioral health assessment, and your physician will counsel and educate you about limiting your dietary fat, how to limit the amount of fat you take in your diet, general nutrition advice, folic acid supplementation, especially for women of childbearing age, tobacco cessation, that is stopping smoking, stop smoking advice, tobacco cessation advice, advanced directives like, don't drink and drive, stop drug abuse if you do practice drug abuse, use your safety belts whenever you're driving, contraception advice, safe sexual practice advice, physical activity, exercise, postmenopausal hormonal replacement therapy for women, preventative medication like daily aspirin in people with risk factors for for people that have established heart disease, kids allergy medication, the inhalers, he or she will evaluate the need for a change or for placement of a person on these meds. Do you know that immunizations are also given during the annual medical checkup? Some of these immunizations given are the tetanus, diphtheria booster, which is usually given every 10 years, the varicella vaccine, if you have a negative test and no history of chickenpox infection, the rubella vaccine, if you have a negative test, the hepatitis vaccine, if not done previously, the influenza vaccine. I talked about that in my previous live stream. It is usually optional, but in many countries, they give it routinely. They advocate for it routinely before the flu season, which is now, starts setting in. So it's optional, but and it depends on your personal preference, but it's highly recommended, especially in some countries where influenza is so rife. We know that influenza has really, really horrible symptoms. It could even cause high morbidity. It could cause death. And so, hey, it could be a very good idea for you to get this influenza vaccine, depending, of course, on where you live and your personal preference. I mean, high-risk groups are also offered the pneumococcal vaccine. For example, the people that are immunosuppressed, they're offered the pneumococcal vaccine, the influenza vaccine, and some people are also offered the hepatitis A vaccine. So ask your doctor if you qualify for any of these vaccines. If your doctor doesn't mention it, it's good for you to know about this. That is why I'm giving this lecture on this live stream. If you're not here to watch the live stream, I'm sure you're going to watch the replay, and please use the advice we're giving you, or should I say I'm giving you today, to ensure that you go for your general medical checkup. And so stay tuned for part 2 of the Do You Really Need the Annual Physical Examination series at the Medical Information Channel's next live session. And don't forget to get your updated checklist of all the essential medical investigations you need for your optimal health in the new year, for my ladies, of course, currently. Just click on the link in my pinned comment in the comment section below the video shortly after you watch this live session. And for my gentlemen viewers, I've not forgotten you. Watch out for your own checklist of all the essential medical investigations you need to do for your optimal health in the new year at my next live stream, part 2. Don't forget to support the Medical Information Channel by buying us a coffee in my pinned comment below in the comment section. I'm Dr. Hadiza Marliya Suleiman, your favorite holistic reconstructive surgeon, and I'll see you again tomorrow. Bye. Any questions? Nobody asked me any questions. And I can see 2 people are live. Any questions? I'm sorry, I didn't ask for that. But please, any questions? I would love to get your questions and your comments. Let me just stay on for a few minutes and see. Any questions? Any questions? Did everybody understand the lecture? Did you enjoy it? What were your thoughts? Anything else to add that I missed out? Any clarifications? All right, no? Oh, somebody gave me a like. Thanks. So like and share. Anyway, you can always drop your comments, your questions in the chat, in the comment section, and I'll be sure to answer them, definitely. So join us next time. Bye.